Stacy. I'm gonna be a nurse today handling your discharge, and I believe this is your wife. Okay, all right. So I just need to go over your discharge paperwork. So you please confirm your name and date of birth. All right, thank you. So I'm just gonna go over this discharge paperwork and the new medications that was prescribed for you. Okay. All right. So generally, you came here because you had frequent urination, increased hunger, thirst, and just not feeling yourself, and you had some issue with headaches and vision changes in your when you came to the ED. Your blood sugars were 600 and your blood pressure was 188 over 120. Okay, that's correct. Okay, so with you have past medical history of hypothyroidism and GERD. And over the past 3 months, you've been you've been visiting your primary care provider, and your blood sugars, the last reading was 150 over 100. And you also had some dependent edema on the lower extremities. Over a little bit of the medications that you're taking home, which you might be aware, is the Synthroid 100 micrograms per daily by mouth, and the Protonics 40 milligrams by mouth daily. Okay, so these are the medications you take home. So the ones that you're going to be taking home, additional 3 medications. So 2 are for blood pressure, okay, and the other one's metformin, which is for the new diagnosis of diabetes. Okay, so the 2 blood pressure medications, the first one is Lopressor, the other name is Metoprolol, which is 50 milligrams by mouth daily. And the Cestrol, the other name is Lisinopril, that's 10 milligrams by mouth daily, okay? And for the diabetes is metformin, 500 milligrams by mouth daily. All right, so I'm just gonna go over a little bit of the side effects of this medication. It is Synthroid. So with these medications, you know that you take these medications alone and not, with nothing else. And, yeah, so very early in the morning, do not combine these medications with any antacids or iron supplements. Yes. Okay, so also something, do not take these medications if with grapefruit juice or any walnuts, soybean, any dairy products like soybean flour. And yeah, that's all. The other thing is that make sure that you're monitoring closely your blood sugars, okay, and your blood pressure. Okay, any changes of weight without even trying, make sure that you let the doctor know. And any chest pain, fast heartbeat, increase in blood pressure, you also let the doctor know, okay? All right, any questions? So the next one is the Protonics. This reduces acid production in your stomach. Okay, so the other name for it is Pantoprazole. Okay, so with these medications, you're gonna be monitoring any chest pain, abdominal pain, trouble swallowing, and any signs of bleeding ulcers. So if you notice any black tarry stools, or any nausea accompanied with vomiting, and if the consistency looks like coffee grounds, you make sure that you tell the doctor immediately. So it just means that this medication is not working for that, okay? So you need to go to the provider, okay? And this medication also can increase the osteoporosis, so or fractures. So just make sure that you also being careful with that one, and only take it for the amount of time that the doctor specified. So make sure that you're taking this medication with or without food, unless your doctor tells you otherwise, and swallow this medication whole. Do not chew it or crush it. All right, so, and if you take this medication twice, since you're taking only once a day, if you missed it one day, you can take it as soon as you remember, okay? All right, the next medication will be the Lisinopril, and that's the Cestrol, okay? So that's the blood pressure, and you can take this medication with or without food. And the one thing with this one is that you make sure that you take your blood pressure before taking these medications, okay? The side effects that you can be looking at will be orthostatic hypotension, so we're changing positions very fast, you can be feel dizzy and like passing out. So just make sure you sit and you change position slowly. Okay. And the one thing that you need to be watching out is for dyspnea, dry, persistent cough, tingling, tickling, and unproductive cough. Okay, so you need to make sure your doctor knows this immediately, and make sure that you're going into the taking those lab tests as the doctor orders, because we need to be watching for UBN, creatinine, potassium levels, also your liver function test, okay, and also your hemoglobin and hematocrit. Any questions? So yeah, just mainly lightheaded, headedness, just change positions slowly, and take your blood pressure before starting these medications, okay? All right, the other one is low pressure. Low pressure is blood pressure medication, is also known as metoprolol. So this medication is, you can take it with or without, with meals or right after meals, okay? So the side effects also orthostatic hypertension, so change position slowly. And if you notice any blur vision, visual disturbances, make sure that you let the doctor know. This medication can also cause decreased libido and erectile dysfunction. Okay, so more than that, I want you to be aware that you need to be taking these medications daily. Do not stop taking it abruptly, because it can cause rebound hypertension. Before you take your medication, make sure that you're taking your apical pulse, which is right there. So you take it for a full minute, and then if your apical pulse is less than 60 minutes, you can withhold this drug, okay? And make sure that you notify the provider immediately. And also these medications, make sure that you monitor your blood sugars closely, because it can mask the signs and symptoms of hypoglycemia, low blood sugars, okay? So yeah, since you're going to be metformin, this is very important for you to be doing. And those are the highlights for these medications, okay? Do you have any questions? All right, so the last one is metformin. So metformin, this is the medications that, because of you were diagnosed with type 2 diabetes, so you're gonna be taking these medications daily, okay? So this medication, what it does is increases peripheral glucose uptake and use, okay? So signs and symptoms of these medications could be diarrhea, nausea, vomiting, and it can also cause vitamin B12 deficiency and hypoglycemia, okay? So, and like I said, the beta blockers, which is the metoprolol, it can mask the signs and symptoms of hypoglycemia. So just make sure that you monitor blood sugars and blood pressure regularly. Okay, the other thing is if you're taking any diagnostic testings that require some contrast dye, make sure that this medication is withheld for 48 hours, because it can cause acute kidney injury and lactic acidosis, okay? Also, do not take these medications if you do not take alcohol if you're taking this medication, because it can affect on lactate metabolism, okay? So you will be probably the doctor might be ask you to check your blood sugars every 3 months, the blood every 3 months, to check your A1C. So make sure you monitor your blood sugars regularly, and especially if you have any infection going on. And so if you have any abnormal blood sugar levels, make sure that you notify your doctor immediately. And do not take any over-the-counter medications without checking with your prescriber first, with your doctor, and report all adverse effects to the provider. Explain if you have any diarrhea, nausea, upset stomach. It might generally subside over a period of time, but you do need to tell the doctor about these symptoms, okay? Any questions? All right.